We were able to rescue a child who had reached a low academic level and was on the verge of becoming a psychological patient, using very simple Ayurvedic treatment. In this child, there was what we call Datugata Jwara or Datugata fever, which is a fever that resides within the tissues. The reason this child was unable to learn was rooted in the brain. A fever occurred. If we only give medicine to reduce the temperature, this fever recedes deep inside. There are many medicines to increase intelligence or concentration or to reduce hyperactivity. If we prepare various Ayurvedic medicines according to that combination, we will get the results we expect. Welcome to Marian Ayurveda. In this episode, we are considering how we can improve learning in children. As we say, even if there's a point that the child must want to learn, beyond that, many physical factors are pulling the child back from their studies. So what are these factors? If these physical problems are resolved, many children can study well. There are children who get good marks in their studies. That's what we're thinking about in this episode. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. I have actually specialized mainly in the field of learning or the mental problems that occur in children like this or major mental issues. My MD is actually in Ayurvedic psychiatry. So as part of this, when we see many children and conduct counseling for them or study their problems, we have seen that resolving their physical issues alone can improve their learning. That's the kind of experience I'm going to share with you first. When a mother came with her child, she said the child was around the age of LKG. No matter how many times the child is taught to write from 1 to 10 or small calculations or things like A, B, C, D, it just doesn't stay in the child's head. The mother teaches many times, but the child forgets it immediately. So when I called this child and examined them, what I was able to see was when touching this child's forehead and neck, there is an intense heat. At the same time, there isn't much heat on the cheeks. So even if we measure this temperature, if we look at a thermometer, it will only show a normal level. But in the head area, the forehead, there's an area called the cerebrum, which helps with execution and is an important area for learning. So when touching here, it's extremely hot. So based on our clinical experience, I knew that we have a concept in Ayurveda. That is, if we get a fever and without actually treating it, we only give medicine to reduce the temperature, this fever will recede inside. It recedes inside, and whichever organ it settles in, that organ will stop functioning properly. For example, if this fever occurs and remains without being properly treated and locates in the kidney, then nephropathy occurs there. Or urine passing with foam, or if we look at this fever in the pancreas, it becomes type 1 diabetes. Juvenile diabetes or diabetes that affects children. Similarly, if it moves to the thyroid, in some patients, if we touch the thyroid gland, it will feel very hot. All other parts will be normal. So if this fever stays in the thyroid, it will turn into conditions like, Hashimoto's thyroiditis. It's the same if this fever moves to the brain. Once it's located in the brain, what happens? It means brain functions won't be normal for children to study. Now for this child, as you know in Ayurveda, there are many medicines to increase intelligence or to increase concentration or to reduce hyperactivity. If we prepare Ayurvedic medicines in such combinations, we will get the results we expect. That is, for children who need stimulation, medicines like Brahmi and Shankapushpam provide hyperstimulation, helping them learn quickly. At the same time, medicines like Yashtamadu and Chandanam and many others are used to calm down children who are hyperactive and restless. So in this way, we can easily improve brain functions. As we know, Ayurvedic medicines don't have major side effects, so we can easily use them for children's brain functions. But when I examined this child, I realized that he had what we call Datugata Jwara, or Datugata fever, a fever that resides within the tissues. The reason this child couldn't study was because it was in the brain. Therefore, we didn't give this child any medicine to increase brain function or intelligence. Instead, we gave medicines that reduce the fever in the brain or the head. Similarly, after giving the medicines, when they came back a month later, the mother said that now her son understands things quickly when he studies. Now he's getting 10 out of 10. The mother was very happy when she returned. So what I'm saying is a child who was at a very low academic level and could have psychologically become a mental patient, we were able to save him with very simple Ayurvedic treatment, and it only took us 2 or 3 weeks to turn him into a child who excels in his studies. So when we say our children aren't studying, aren't sitting still first, touch the child's head, forehead and neck. If the temperature is high only in that particular area, it means a persistent fever is affecting his brain. If this is treated, the child will be able to study much more comfortably and as a result get good marks. understand that by seeing a good Ayurvedic doctor and getting the right treatment, we can truly make a significant difference in the field of education. Thank you for joining us today, and we hope you found this episode helpful. See you again soon with another episode. Thank you, and take care.